Good morning, everyone. Welcome to Grand Rounds. It's my great pleasure this morning to introduce our speaker, Dr. Kristie Ebi. Dr. Ebi is a professor in the Department of Global Health in the School of Public Health and Community Medicine at the University of Washington. She is also a professor in the Department of Environmental and Occupational Health Sciences at the School of Public Health and Community Medicine. Dr. Ebi received her Master's of Science in Toxicology at the Massachusetts Institute of Technology and her Master's in Public Health and Epidemiology at the University of Michigan School of Public Health. She then completed a Ph.D. in epidemiologic science, also at the University of Michigan. She has served in numerous important roles, including testifying to the House of Representatives Committee on Science, Space, and Technology, and the Committee on Energy and Commerce. Most recently, she has served as a member of the Washington State Academy of Sciences and a National Associate to the National Academies of Sciences, Engineering, and Medicine. She was a speaker at the Nobel Prize Dialogue on the Future of Health, Equality, Responsibility, and Research. We are absolutely delighted this morning to have Dr. Ebi with us to speak to us about climate change affects health. Dr. Ebi, thank you so much for joining us.
Sorry, somehow I got muted in the process. Thank you very much for the kind introduction, and I really appreciate the opportunity to talk with you today. I would like to start by putting up the QR code for those of you who need to get the credits. So I'll just take a moment and let everybody take the screenshot, whatever it is you do. We never have to get credits in population health, so hopefully that's enough time. If not, we can go back to this later. I want to start out with one of the key messages, which is that climate change affects children primarily. When we look overall at the health impacts of a changing climate, about 85% of those impacts are on children. In the United States, when people think about climate change, they think about polar bears. The polar bears definitely are endangered, and it's children that we really should be thinking of when we think about climate change and health. When we think about climate change and health, we start with what's causing our climate to change, emissions of greenhouse gases that lead to higher concentrations of carbon dioxide, methane, and other gases in the atmosphere. And these changes affect temperatures. We've all had heat waves. I'll talk about that in a moment. Affect precipitation patterns, cause our sea levels to rise because warmer oceans take more volume, and increase the frequency and intensity of extreme events. But we don't just look at that. We don't just look at these changing exposures. We look at how these interact with a wide range of demographic, socioeconomic, environmental, and other factors that influence the magnitude and the pattern of our risks. I listed a few of those in the box in the middle. The interaction between these factors and our changing climate then affects the exposure pathways we're used to in health. These are listed across the middle, from extreme weather events over to social factors. Underneath that is a not complete list of all of the health outcomes of concern with climate change. As you look across that list, you can see that these are issues that are on the agenda of every department of health, not every department of health, but across all departments of health, ministries of health. These are cross-cutting issues. Climate change is going to be affecting the way we think about and practice population health in the future, because climate change is one of a number of cross-cutting themes. Population health has been very effective in the past, in reducing the burden of malaria, of diarrheal disease, other climate-sensitive health outcomes. But we're doing that typically in a stovepiped way. And climate change is saying that we really need to connect these up. And I'll talk about that as I go through the presentation. All the health outcomes of a changing climate, all our concerns, are current problems. We're not talking about new diseases. New diseases may arise, but it's far, far, far less likely. We're going to see changes in the geographic range, seasonality, intensity of transmission of, for example, infectious diseases. We're going to see shifts in the pattern of these climate-sensitive health outcomes. And because they're all current problems, then we have a very good understanding of exposure and resilience and how they vary across populations and across communities. And these are just some examples that were put together for the 4th National Climate Assessment. I'll start out by talking about some of the climate-sensitive health outcomes of concern. There is a new figure that just came out yesterday, I believe, on billion-dollar disasters. In the United States, NOAA tracks billion-dollar disasters, has been doing this for quite some time. Last year, there were 20 billion-dollar disasters. The ones through September are shown on this slide. And I want to point out that these are the billion-dollar disasters. They are not the $100 million disasters, the $10 million disasters. And collectively, these billion-dollar disasters in the US has been costing the US over $50 billion per year. So when you hear that climate change is too expensive to address, think about how or whether we can afford to keep paying for these disasters year after year, instead of addressing the root problem of why we're seeing an increase in the frequency and intensity of extreme events. You all know the consequences of extreme events. I wanted to point out something else that is really rising on the research agenda, which is mental health. These are some data from Public Health England. They've since changed their name. They've got several really good studies. There's been massive flooding events in parts of the UK where they followed people for several years. And this is right after one event. And quite usefully, the research separated out people whose residences were flooded from people whose residences were disrupted versus not flooded. And you can see the very significant difference across these 3 groups in probable depression, anxiety, and post-traumatic stress disorder. As I said, this research has continued for several years, and several years out, you continue to see a difference between these groups, which means that the mental health consequences are much longer lasting than people have paid attention to historically, and will be an issue as we have more extreme events of having more people with mental health issues and finding ways to more effectively prepare for and address those issues as they arise with these events. On the theme of extremes, you may or may not know that July was the Earth's hottest month on record. And this just gives you some of the temperature extremes across the world. So it was worldwide phenomena. Climate change is affecting all of us. And you can see the land surface temperature over the northern hemisphere was almost 3 degrees Fahrenheit above average. When you look, if you watch your local broadcast meteorologist, you'll regularly see about temperature records being broken or precipitation records being broken. The temperature records are typically broken by tenths of degrees. So talking about 3 degrees is a huge increase over the whole North America area. I live in the Pacific Northwest. This was July. And in June, in June, we had the heat dome that settled over Seattle, Portland, and Vancouver. And you can see that the historic heat wave broke previous records by more than 10 degrees. This is one of the few events where you've seen that large a breaking of earlier records. This event lasted for several days. It was a region that was unprepared for having a significant heat wave. Estimates are that between Portland, Seattle, and Vancouver, approximately 1,000 excess deaths. Those analyses are being done. We'll get more precise estimates as soon as all the analyses are completed. But one thing that is interesting to think about is we have these heat waves. There's over 1,000 deaths. There was a heat wave, several heat waves in Europe in 2003, about 70,000 excess deaths. A couple of years later, there was a heat wave in Moscow, about 50,000 excess deaths. And we don't talk about these as mass casualty events, but they are. And they're continuing to occur. They're becoming much more extreme, and people are needlessly suffering and dying. When we think about this event, I said that we were pretty much unprepared. There was a fascinating webinar at the end of August about this event. Particularly interesting part of that webinar were 5 medical personnel from the emergency departments around the region talking about their experiences. One of the emergency departments received a call at the height of the people coming into the emergency department, was receiving a call every 9 minutes of somebody in trouble with the heat. The emergency departments didn't have ways to cool down lots of people when they come in really hot. So one of the emergency departments was putting people in body bags and putting ice in the body bags to try and cool them down. So real significant impacts on our healthcare in the middle of COVID, of being overwhelmed with people coming in suffering from the heat. And we can say that almost all of those deaths are preventable. Those people didn't need to die. This is an outline of physiological pathways by which heat affects our health. I assume you know this. I don't think I need to go over this. So it's just a reminder that as our core body temperature rises, that our cells and our organs are affected in ways that can send us to emergency departments, can lead to death. When we look at the excess deaths in a heat wave, about half of those deaths are due to cardiovascular disease. So the strain on the heart is really important to understand. And you can think about why we don't have great records about heat waves, why we look at excess deaths and not people who die from the heat specifically. And that's because if somebody comes into an emergency department with a heart attack, all of the effort has to be on saving the life. There often isn't a consideration of, are they having a heart attack because they're just too hot? And that doesn't get recorded in ways that then can be easily accessed and analyzed. There's been lots of efforts to understand the impacts of heat worldwide. There is a publication every year called the Lancet Countdown that tracks about 44 indicators. This is from the Lancet Countdown publication from about a month or so ago, showing the exposure of vulnerable populations to heat waves, children under the age of 1 and adults over the age of 65. You can see from 1980 a huge increase in the number of exposure hours, person days, to heat waves around the world. And you can see the headline statement there that for adults over the age of 65, that in 2020, there was 3.1 billion more person days of exposure than the average over 1986 to 2005. Again, emphasizing increases in the frequency and intensity of extreme events. And there's lots that can be done. Heat wave early warning systems save lives. And these systems are in place in many communities. They're not in place in all communities. There's going to need to be an effort to ensure that everyone has access to a heat wave early warning and response system. Setting one up is not terribly difficult. It requires more coordination and collaboration. That when you think about who needs to respond when there's a large heat event like the heat dome, you of course think of the population health services, you think about the emergency departments, the medical care. There's also EMT, folks who reach out into the elderly care institutes, the folks who look at where homeless are residing out in the street, and looking at ways to reach populations that are particularly vulnerable. So you do have to have lots of coordination of city services. And I put in the newspaper headline at the bottom that heat is also a big inequity issue. When we look at red line districts in particular, most of those red line districts have fewer trees. Therefore, they tend to get hotter during a heat wave. And finding the trusted voices that can reach out to these areas and ensure that they understand not only the hazard that it's going to be really hot, but also all of the options they have for trying to take care of themselves, their family, and their neighbors. Both of our regions are concerned about wildfires. Big issue as climate continues to change. This just shows thousands of acres burned in Western states from 1980 to 2019 with increasing temperature. And you just see lots of variability, but also big increases. And wildfire smoke affects our health. I put this in because it's a reminder of wildfire smoke exposure to PM 2.5 and other particles increases the risk of diabetes, lung, and heart disease. But I also put it in because you see at the bottom, the air quality index goes up to about 120. You can see anything over 60 is unhealthy. A couple of years ago, when there's a lot of smoke blowing into Seattle, in my neighborhood, the concentrations were over 250. I understand someplace in LA during the wildfires over the summer, the air quality index was over 750. So really significant exposures when we have wildfires. All right, I'm gonna stop for a second. I can see there's a question. Oh, the question disappeared. What happened?
You can continue, Dr. Ebi. Thank you.
Oh, sorry, I was just gonna try and answer the question, but it's gone. Sorry. This is some recent research published from British Columbia that is very effective for helping us better manage these changes in extreme events. And you can see for the region around Vancouver, there was research done that looked at extreme heat exposure, developed an index of sensitivity, adults over the age of 65, children under 1, marginalized communities, places that they knew would have greater exposure. And then also looked at the ability of those communities to manage those higher temperatures. Did they have a heat wave early warning system, for example? So they developed this for heat, but also for sea level rise, flooding, wildfire smoke, and ground level ozone. And this shows you the 4 vulnerability indices for these different kinds of exposures, because of course, all of these are increasing with climate change. And then combine them into looking at the places around British Columbia that are at the highest risk. And this is then helping focus city services so that they know where it is they need to focus first. What are the urgent and immediate priorities so that the most vulnerable populations can be protected. And I assume that these kinds of efforts are going to be replicated in other communities because they're so helpful for decision makers. If we were in person, I would ask how many of you have allergies. Usually a fair proportion of the population raises their hand. On the left, you can see the ragweed pollen season has gotten longer. Up in places that are getting close to the Pacific Northwest, you can see about a 30-day increase, a month-long increase in the pollen season. Spring is coming sooner, fall is starting later, our summers are warmer. Ragweed's pretty happy with that. At the same time, the carbon dioxide that's driving climate change is affecting plant physiology. And I'll talk about this in a moment, but it's affecting plant physiology in a way that means there's more pollen produced. So we've got longer seasons and we've got more pollen. I won't talk about poison ivy because you don't have that, but just to know that there's changes in other plants that mean we can have more exposures than we do today. The biggest health risk of a changing climate is going to be undernutrition for 2 reasons. The first is shown on this slide that shows you wheat yields by change in local temperature. The red and the blue lines have to do with different assumptions about adaptation. On the left, you can see in the temperate regions as local temperature increases, there could be a small change in wheat yield. It could go up a little bit, could go down a little bit, not a big change. The concern is in the tropics. Any increase in local temperature is associated with a very large decline in wheat yields. Today, there's about 600 to 700 million people worldwide who are food insecure. And all of the projections say that as climate continues to change, those numbers are going to go up. The second mechanism is the carbon dioxide itself. 85% of our plants have a particular mechanism in the photosynthetic pathway for taking carbon dioxide from the atmosphere, breaking it apart into carbon and oxygen, and using then the carbon for the plant to grow. And that 85% includes wheat and rice, which together are responsible for about 65% of all the calories in the world. I mentioned 600 to 700 million people are food insecure. About 2 billion have micronutrient deficiencies. And that's why this pathway is so important. You can see that CO2 promotes plant growth. That's absolutely true. You'll see often in the media that CO2 is plant food, and it is. Plants do grow faster, and it changes the balance in the plant of carbon-based molecules and nitrogen-based molecules, ending up with more carbon-based molecules, which means you have more carbohydrates and less protein by about 10%, micronutrients by about 5%, and B vitamins on average about 30%. Various projections of what these changes in CO2 could mean result in estimates of hundreds of millions of people being affected. So this is going to be a significant factor going into the future. And you can start thinking about how even populations in the US will be affected, that poorer populations tend to eat more carbohydrates. Those carbohydrates are going to have less nutritional value. The nutrient density of our food will continue to decline. This appears to be a linear relationship between CO2 and nutritional density for the C3 crops. This was a recent study looking at the global availability of dietary protein, iron, and zinc, combining the positive influences of technology change, market responses, the CO2 fertilization I mentioned, with the negative impacts of climate change on productivity and the carbon penalty on nutrient content. You can see by mid-century decreased growth in the global availability of protein, iron, and zinc by significant amounts. So again, this is going to be one of the major challenges that we'll have to face as we go into a much hotter future. Moving on to one of everybody's favorite topics, vector-borne diseases. I put this cartoon in to make the transition, also to make the point that the mosquito has to be Betty, because it's only female mosquitoes that bite. They need the protein from the blood to be able to lay their eggs. I'm not going to go through this slide, but it just makes the point clearly. When you look at the transmission of a variety of diseases by mosquitoes primarily, but also by some ticks, that temperature and precipitation affect the development, the survival, and the reproduction of mosquitoes. Temperature also affects the replication of the virus within the mosquito. So there's two ways that temperature affects the transmission of a variety of vector-borne diseases. One of concern in the United States is dengue fever. Dengue fever is carried by, in the United States, primarily Aedes aegypti, although we also have Aedes albopictus, but most of the research is focused on Aedes aegypti. And you can see in the map on the left, in the beige colored areas, an estimate of the present day suitability for Aedes aegypti. This is modeled because vector control programs vary significantly from state to state. California's got one of the best vector control programs in the country. Other states don't have such robust vector control programs. So based on a lot of research, it's modeled where we think we probably have Aedes aegypti. And then the projections for towards the end of the century are in red, showing a very significant expansion of the geographic range of Aedes aegypti. As it gets warmer, the mosquito is just going to move its geographic range. There's nothing stopping it from doing so. And you can see, I live in Seattle, even Seattle might have Aedes aegypti in about 2070. But it's not just having the mosquito. The summer has to be hot enough and long enough that if you introduce dengue fever into a mosquito, there's time for that replication of the virus in the gut of the mosquito and a time for the mosquito to survive. The mosquito has to survive to bite somebody else. And when you take all of those factors into account, you can see on the right, the transmission suitability is much decreased. Still a very large increase in the geographic range of where you could see dengue cases, but much smaller than the projection on the left. However, breeding colonies of this mosquito were found in Toronto, Toledo, and Detroit a couple of years ago. The mosquito can breed in the water in the bottom of a flower pot. It's 100% adapted to human environments. It will fly a mile to bite a human. So once you have the mosquito established, it's almost impossible to eradicate. I've never done this. Colleagues who are entomologists have done this. They say if you go down into sewer systems, there's millions of mosquitoes. It's hot, it's warm, it's moist. And so mosquitoes have learned to overwinter in sewer systems and then come out in the spring. So once you've got these mosquitoes, they're with us and they're very hard to control. And you can see for San Francisco, the bottom left, big increase by the 2010s already in the number of mosquito days, which means that the transmission of vector-borne diseases is very likely to increase significantly in the US unless we're much more proactive with our population health programs. And just like with heat, there's possibilities for early warning systems. I'm just going to talk about the top two panels. The top panel in pink shows you the traditional epidemic curve when there's an outbreak of an infectious disease, typically looks like that. In red is when you've got a passive surveillance system. You don't actively look for the disease, but you are ready as a system when disease is reported. And you can see that just even having a passive surveillance system, there's a big decline in the number of cases. If you add surveillance and an early warning system, you can even more significantly reduce that outbreak. You can see on the left that there is passive surveillance, early warning, than active surveillance. Singapore has got the best dengue control program in the world. They are in the process of, or have just implemented an early warning system based on environmental information for dengue. And that early warning system gives them 4 months. 4 months to clean up breeding sites, 4 months to warn pregnant women, 4 months to be prepared. You can't alter the environmental conditions, but you can make sure that everybody's prepared and that when you do have the conditions for an outbreak of dengue, that you don't see very many cases. I wanted to move on to figures that have been used in the Intergovernmental Panel on Climate Change since 2001. And I can give you the history if you're interested in that. But these figures are designed to synthesize all that we know about particular issues. Here you see 6 different climate-sensitive health outcomes. And I'll just use heat-related morbidity and mortality as the example. The 0 line are pre-industrial temperatures. The y-axis then are increases in global mean surface temperature above pre-industrial. The dots I know are distracting. It's a program that we run and you can't seem to do anything about the dots. The dots just have to do with level of confidence in transition from one color to another. Where the color is white, it means that scientifically we haven't been able to see that heat-related morbidity and mortality has changed. That it may have changed, we can't detect it, we don't have enough data, don't have enough long enough of a time series, a whole bunch of reasons why we might have not detected a change. Could not have been a change, of course, but in this case, we know there's been a change. When the color turns to yellow, it means that in fact, climate change is already causing an increase in heat-related morbidity and mortality. When the color turns to red, the risks are very high, and at purple, they're very high. Because of the color schemes, these are called across the community burning embers. So these are burning embers for health. And when you look again at heat-related morbidity and mortality for the 3 embers, the one on the left is for a world that breaks into large world regions where there's a high degree of conflict and very high challenges to adaptation and mitigation. The ember in the middle is a world that continues along its current trends. We do some things well, some things not so well, but we continue our current trends. And the ember on the right is for a world aiming to sustainable development, where there's real efforts to achieve the SDGs as soon as we can, probably not on time, but as soon as we can. And so one thing I hope that jumps out at you when you look at these figures is the very strong interaction between climate change and development. That climate change is definitely increasing risks for these 6 climate sensitive health outcomes. We didn't do more than this because there weren't enough projections, but also our development choices really matter. And you can see, particularly for heat, we can be into high risk within about a decade, perhaps 15 years, if we don't reduce our greenhouse gas emissions and if we don't take action on heat wave early warning systems, for example. And so this is a synthesis figure you'll see coming out for lots of different sectors when the Working Group 2 report of the Intergovernmental Panel on Climate Change comes out in a month, the 6th assessment report. And I wanted to finish up with just some comments about mitigation. There is 30, 40 years of research showing that every ton of CO2 emission adds to climate change. There's lots of emphasis in the media about annual emissions. Annual emissions are important. What matters from the perspective of the atmosphere is how much have we put up there in total. The US alone is responsible for almost 25% of all the carbon dioxide in the atmosphere. And this shows you up until about 2050, there's different pathways that could be followed in terms of our emissions and in terms of our development choices. That's what the SSP 1-1.9, and I can explain those, but those are just different combinations of emissions and development choices. And for this particular figure, you can see that there is beginning to be some divergence between 2020 and 2050, real strong divergence after 2050. In the US, more of our emissions come from transportation than come from any other sector. In California and in Washington, much more than 29% of our emissions come from transportation because of the choices of our electricity sectors. And so figuring out how to facilitate the transition in transportation to both more electric vehicles and, more importantly, making sure that more people find alternative forms of transportation. It's important because when we look across all of the basket of mitigation options, almost all of those have benefits for our health. There's a robust literature base looking at the co-benefits of mitigation policies for health, primarily looking at transportation, of getting people more walking and more biking. We know that when people walk and bike more than they do today, that they can lower their blood pressure, they can lose weight, they can be healthier overall. Looking at emissions from point sources, particularly coal-fired power plants, and making sure that we reduce exposure to air pollution that kills about 7 million people around the world every year. And changing diets so that people don't eat any more red meat than their doctor allows or their doctor recommends. So trying to shift to more sustainable diets. And when you look at the benefits of avoided hospitalizations, avoided premature deaths by making these changes, the value, the health value is of the same order of magnitude, if not larger than the cost of mitigation. So when you read about how expensive mitigation could be, we're really working hard to pair that with a message of mitigation may cost this, but our healthcare costs are going to go down by at least the same amount, perhaps more. People will have healthier, longer lives and will have really benefited the planet. And of course, all of the other climate sensitive health outcomes we're concerned about. This is just one example for diet and health co-benefits. This is again from the Lancet Countdown and just shows that the estimated deaths due to excess red meat consumption in just 1 year rose by 1.8%. And you start translating that into the number of deaths and think about what could be done if we could get people to adhere to at least the recommended diet from their doctor. Of course, there's benefits if people move into more sustainable diets, you see much larger benefits. But overall, the health co-benefits are really large. Here's an example from New Zealand I like mostly because I really like the picture, but shows that just shifting 5% of short urban car trips to bicycles would save $200 million in healthcare costs. And you would see 116 deaths avoided because of increased physical activity versus 5 extra road crash deaths. So more of these studies are coming out. We're hoping to find ways to get this message out more clearly to the general public that there are benefits for their health immediately from mitigation. There's also benefits then, of course, by avoiding all the climate sensitive health outcomes that I talked about. And that is a broad and fast run through. And I really look forward to having a discussion and answering your questions. So thank you.
Dr. Ebi, thank you so much for that thought-provoking and really important presentation. We're so grateful to you. We have a question from Dr. Wagner. He says, you said as much CO2 comes from electricity as from transportation in the US. What does that say about adopting more electric-powered than fossil fuel-powered devices?
It's a good question, and it has to do with what we're going to do with our energy transition. I live in a state where most of our electricity comes from renewables. California, a lot of your electricity comes from renewables. And so you don't look at any of these issues in isolation, that you want to think about how to facilitate this transition in our electricity industry, so that we do use more renewables as we have more electric vehicles. That makes sense?
Thank you. Dr. Ebi, you mentioned the importance of physicians providing recommendations to patients regarding lifestyle change. Do you have any specific recommendations to us, particularly those of us who are primary care doctors, in terms of how we can impact climate change through our role as advocates for our patients' health?
It's a great question, and I've got a couple of different responses. So the first, from my perspective, is the more you educate yourself about climate change, the more prepared you're going to be when you see something unusual show up in front of you. I remember working on the first national climate assessment. We had a meeting. There were some colleagues that came from Canada to join that meeting. This was back in about 2000. And listening to one talk about several people in Canada that had just died of malaria because they'd been to a country, but it was during a time when it was considered that there wouldn't be transmission of malaria, and the physicians didn't recognize it. And sadly, the people died of malaria because they just didn't figure it out in time. Another issue that's a good illustration in Canada is Lyme disease is changing its geographic range. Not many physicians in Canada are trained to identify Lyme disease. And so if you're presented with somebody with a high fever who's been in Asia, for example, do you think about dengue fever? Do you think about chikungunya? Both are quite possible. And so thinking about what is in front of you, where people have been, where it could have come from, beyond what people have been traditionally trained to identify. And then on the other part of your question, physicians are one of the most trusted sources of information in the United States. And thinking about, again, as you treat patients, what the opportunities are. I talked about how many deaths there were. There was this in the heat dome in Seattle, Portland, and Vancouver. There was a 69-fold increase in people presenting to emergency departments and primary care facilities. And this is an opportunity to make sure that people know what to do in the heat, make sure they know how to protect themselves, their friends, their neighbors. But also, if the opportunity is there, there's a reason why these temperatures are going up, and these temperatures are going to continue to go up. That this heat wave is not going to be unique. When you look into projections later in the century, the kinds of temperatures we saw in the Pacific Northwest are going to become more normal. And it depends on your relationship, of course, with a patient, but thinking about where you can provide information that would be useful for them to protect their health, but also to make choices that'll protect everybody's health.
Thank you. From Dr. Mohammed, you mentioned the spread of infectious diseases. Do you think that the rise of pathogenic fungi may be related to fungal species now being able to resist mammalian febrile response as a result of rise of global temps?
That's a great question that I won't answer because I don't know the answer. But I will tell you there are so many great questions around climate change and health. And one of our main constraints is there's no funding. And so I always really appreciate questions like this because this is an area where research needs to be done. NIH has failed to invest in climate change and health for decades. There is now money within the budget from President Biden for NIH to have about $100 million on climate change and health, which on the one hand sounds like a lot of money. On the other hand, it's just 0.2% of their budget. And you look at the size of the various institutes, it's really, really tiny. And yet we need those investments because we need to answer those kinds of questions. We do see that there has been impact on fungi because temperatures are higher, summers are longer, and we are seeing various changes in exposures to a variety of pathogens besides the infectious diseases I just mentioned. So thank you for that.
Dr. Ebi, thank you so much for this terrific presentation. We're so grateful to you for sharing this work with us, and we look forward to hearing from you again in the future.
Thank you very much. I really appreciate everybody's attention.
I hope to see all of you again next week at Grand Rounds. Oh, we have one more question. We still have time.
I'm happy to answer questions. I couldn't believe that everything I said was clear, but
from Dr. Rubin, he says, while the Western states, blue, had made a switch to alternative energy sources, the Midwest states have had coal-burning plants that not only fuel global warming, but also carry pollution to the east, which raises the question of how do those enlightened influences how do those enlightened influence in a real way those who rely upon old school energy sources?
It's a good point, and we do have to make this energy transition. I will point out that the state with the fastest growing number of wind farms is Texas. That It's not what you'd expect, but there's many communities in Texas that have realized renewable energy is more reliable, it's cheaper, that once you take away the subsidies for coal, that they're putting in renewable energy sources. Many of the energy companies in the Midwest are looking at moving towards renewables. So there are openings for these changes to be made. And all of us are trying to help encourage those shifts. I also want to point out that people often say that thinking about climate change is really discouraging, particularly when you look at the national level and our inability to do much nationally. But when you look subnationally, when you look at our states, when you look at our cities, there's all kinds of changes that are going on. In California, there's been huge shifts in terms of your energy infrastructure. There's lots of planning for our different future. Same is going on in the state of Washington. Thousands of cities around the world have set their own goals for reducing greenhouse gas emissions. Every major automobile manufacturer has set a date by which they're going to be out of internal combustion engines. They will no longer produce them. So there's quite a lot of a shift going on. And the more we can facilitate that shift, recognize it, and talk with others about it. So I'll make two more comments as long as I've got the time. So one on the energy transition is already underway. I was really struck last week. I was in an underground parking garage, and the only sound I heard was almost like wind chimes. It was all this tinkling noise. And it just really struck me that I was in an underground parking garage, and where were the wind chimes? And I realized it was all the electric vehicles. I didn't hear an internal combustion engine. And that's the sound of the future, of being in an underground parking garage, and just sounds like a bunch of wind chimes, which is always a much nicer sound to listen to, shall we say. The other point is how important it is to talk with others about climate change. That there is something called the Six Americas. You can find it. It's a big project at Yale University. And it's been doing regular surveys of the US population and their opinions about climate change. And more than 2/3 of Americans are worried about climate change. And you can go through really impressive numbers. It's not numbers that you would expect. More than half of Americans think we should be doing something at the national level about climate change. But interestingly, one of the questions they ask is how many people are talking to anybody else about climate change? And only 1/3 of Americans are doing that. So you've got 2/3 are no climate change is happening, think they're being affected. More than half think we should be doing something as a nation, and people don't talk to anybody else about it. So having those discussions is really important.
I couldn't
Question
agree
on
more.
black tarmac. Oh yeah, it really retains heat. And yes, there's a lot of work that has to be done to transition our infrastructure. When you think about cities, at some point, there's going to be transitions. We're going to see more white roofs on buildings. We're going to see more green roofs. We're going to find ways to decrease the urban heat island and make sure that we have materials, not black tarmac, that absorb so much heat and just make our cities so much hotter than the surrounding areas. Good question.
Excellent. Last chance for any questions. Thank you so much, Dr. Ebi.
Oh, we've got one more.
Oh, we got one. What is the developing countries' share in this climate change? Is there any significant difference in rising temperature between developing countries and developed countries?
I didn't show any of that, and I could have done so. Temperatures are rising everywhere. They're not rising evenly. And so we know, of course, that the Arctic is warming faster than anywhere else. Parts of Africa also are warming almost as much as the Arctic. So there's real uneven warming. Everybody is being affected. And it is an issue that every country has to deal with. The low and middle income countries are acutely aware of climate change. You see all the denialism we have in the States. You don't see that in other countries. There's an annual meeting of the countries that have signed on to the United Nations Framework Convention on Climate Change. There was one in Glasgow. You probably saw some media coverage of Glasgow. I was only virtual in Glasgow. I was at the one before. There were 4 television stations from Bangladesh at this meeting, spending all day, every day, interviewing people. Anybody in Bangladesh knew more about what was going on in those negotiations than anyone in the US. There is very high awareness. There's very deep concern. There's a lot of action going on. And there's a lot we can learn from these countries as they begin to adapt to a changing climate and as they become more creative in terms of mitigation.
Excellent. Thank you so much.
My pleasure.
Have a great day.
You too. Thanks, everybody.
Okay, folks, last chance to get your CME credit.